Hi, good morning, Antonio. My name is Juan Lester. I'm your invigilator for the OET speaking session on the 19th of May 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Antonio Luis.
And what is your candidate number, please?
My candidate number is 233312442.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please? Sure. Here it is.
Sure, here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Talk about a time when you surpassed patient care expectations. What was the situation, and how was that exceptional care provided?
During the clinic, I was given the task of administering flu shots. A 10-year-old boy came in to get his shot, and I could tell he wasn't happy about it. He was visibly tense and nervous about the needle. I prepared his upper arm for the injection and started joking around with him. I asked him about his favorite sports team and the TV shows he liked. Meanwhile, I was able to give him the shot easily, after calming him down with our chat.
Tell us about your approach to dealing with frustrating individuals.
First, I expect to encounter frustrating people and situations. It is part of the job, and they don't allow challenging individuals or circumstances to rifle my efficiency or demeanor. Whether it's an employee conflict, a management issue, or a patient situation, I look to both sides for information and solutions. I find that, if I keep myself personally out of the conflict, it is much easier to arrive at a fair decision.
How do you cultivate an environment of respect in the workplace?
Respect is an essential component of a successful work environment, and I believe it always starts at the top. As the saying goes, give respect and take respect. In order to expect respect from employees, I show respect to each individual, no matter their position. While it is important to establish and maintain a leadership role, this can be done with regard for the individual lives and talents of the other workers. I do my best to quickly learn all the names of people I directly work with. I also find it helpful to promote an open-door policy, so that, if there is ever a problem, employees feel comfortable coming to me, without fear of retribution.
Illustrate a situation in which poor communication was affecting the work environment. What was your response?
During my previous employment, I attended multiple staff meetings, and had to combine information and decisions from each consultation into my day-to-day operations. When I arrived on staff, the department meeting was always held after the executive meeting. This led to a great deal of repetition. I rescheduled the staff meeting to before the executive discussion. I informed my team of issues that directly affected them, and allowed them a few minutes to give comments. Our department's voice was heard much more efficiently, and we needed only a few minutes to communicate feedback from the executive meeting during our own staff conferences.
Is compassion a necessary trait to be a nurse?
Compassion means a feeling of understanding and concern for suffering. It is one of the important traits necessary for a nurse to have. So the answer is yes. I believe that compassion is one of the prime qualities for nurses to discharge their duties effectively. If a nurse can't get emotionally involved with the patients, then the nurse won't be able to take the quick actions that are of prime importance in this role. However, I always try to stay objective and practical, which allows me to take quick and rational actions, even in tough times. At the same time, being compassionate helps me to offer the services with much more understanding.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the roleplay after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the roleplay card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you.
Excuse me, please.
Yes. How may I help you?
Can I have a name for the patient, please?
You can use my name.
Okay. Thank you.
Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello, good morning, Juan. My name is Antonio, I am the head nurse of the hospital. And how are you today?
Hello, good morning. I am all right. Thank you for asking.
How about your gum problems?
Yes, it still exists. So the doctor had informed me about taking a gum biopsy.
Oh, I see.
Nurse, I am very anxious about it.
Your anxiousness is quite normal. If you can share the exact concern for anxiety, it may help you overcome it.
Good to hear that, nurse. Even if I have heard about biopsy, by goodness, none of my dear ones had a biopsy. That being the situation, it's for the first time I am being focused on it. So, I don't know exactly what biopsy is.
Don't panic, Juan. It is for a better understanding of your gum problems.
I was quite upset during the consultation, and I couldn't follow what the doctor said about the biopsy. Could you please help me to know about it?
No worries. If I were you, I would have been the same. I will explain what a biopsy is.
Thank you, nurse.
No mention, please. Now, simply to define it, a biopsy is a sample of tissue taken from the body in order to examine it more closely. Okay?
Yeah, okay.
Why a doctor would have recommended a biopsy is that, when an initial test suggests an area of tissue in your body is not normal. I will make it clear for you.
Alright.
The doctors may call an area of abnormal tissue a lesion, a tumor, or a mass. These are general words used to emphasize the unknown nature of the tissue. In your case, it is a lesion. Means, a wound.
Oh, okay.
You have been visiting the doctor many times for gum problems. Isn't it?
Yes. It has almost become a routine for me.
Don't be disappointed, Juan. The suspicious area, noticed during the doctor's examination, is now recommended for detailed study. So that, you will get better treatment.
I acknowledge that, nurse.
May I know if you have any other concerns, please?
I fear how painful the gum biopsy will be.
Thank you for sharing your concern. The answer is no. You won't feel the pain.
Oh, is it?
Exactly. The reason is that, before the biopsy, an injection will be taken. It is for numbing the gum area, so that you will not feel the pain. After your gum biopsy, the numbness in your gums will gradually wear off. Aren't you relieved to a great extent, Juan?
Yes, I am.
Clarifying your concerns will be a great relief all the time, rather than holding to it. So, may I know, if I could help you any more, please?
Are there any risks involved in the biopsy procedure?
There are different methods to conduct gum biopsy. Each one has its own advantages and risks. The selection of the methods depends on several factors. So I cannot assure you on the method in your case. Else, I can give you a general idea for your understanding.
Okay. That will be fine for me, nurse.
Typically, the biopsy is a non-risky procedure. A part of the tissue is collected from the affected area. This tissue will be tested further. And, you can resume your normal activities and diet on the same day.
Okay.
Nevertheless, some of the risks involved in the procedure include bleeding from the biopsy site, infection of the gums, soreness.
All right. Are they minor risks?
Your question is sensible. However, as long as the precautions are taken, these are minor risks for a majority.
Okay. I understand what you mean. May I know about the precautions that one has to take after a biopsy?
Nothing much, Juan. You may be asked to avoid brushing around the site for 1 week. And to take care of the part while chewing.
Okay. I got it.
If you received stitches, you may have to return to the doctor in order to have them removed.
Oh, I see.
Is there anything else I can do for you?
I got the information I was looking for. Thank you for your time.
No worries. Pleasure is mine. One thing I would like to remind you is that you should not eat anything through your mouth, at least a few hours before the procedure. Am I clear?
Oh, yes. So I think the morning time is best.
All right, you can get an appointment accordingly.
Sure. Thank you, nurse.
You are very welcome. I wish you a faster recovery.
That is the end of your out-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.